The surge in cases that public health officials are expecting could force healthcare workers to make some gut-wrenching decisions. As Kristina Rex tells us, doctors may have to choose which patients get access to life-saving equipment.
Right now, Massachusetts is in the contingency stage, building field hospitals like the one here at the Boston Convention Center and hoping to prevent a healthcare crisis. But should we reach that point, the state released a new plan.
We go from our usual standards of care to crisis standards of care.
And that would mean choosing between patients for ventilators and ICU beds. Should Massachusetts reach the point where critically ill patients outnumber resources?
It's a scary thought that a doctor, a nurse, or someone else in the hospital is going to look at you, put a score on you and say, if you were one score higher or lower, we'd give you an ICU bed, but now we can't.
Dr. Joshua Kornbluth of Tufts Medical Center is on the recently formed state committee that just released a triage plan in which patients are scored and prioritized for critical care.
Not just maximize the number of lives saved if we need to enact it, but to maximize the number of life years saved.
So if a 26-year-old with asthma who needed a ventilator and an 80-year-old with heart disease, it's likely that the 26-year-old would get the ventilator in this crisis case.
There would be some other nuances to it, but it's fair to say that's a possibility.
That's a scary thought, isn't it?
It's very scary.
We aren't there yet, and doctors hope with proper social distancing and hand washing, this triage plan will never be used.
It may be, non-standard care for the foreseeable future, but we may not cross that threshold into crisis. And that would really protect a lot of people.
And the guidelines are clear that no healthcare decisions will be made based on race, gender, or socioeconomic status. In Boston, Kristina Rex, WBZ News.